Hey guys, it's Nurse Brian again. So, the first one that the first video I'm going to start out with is the subcutaneous testosterone injection. It's a little bit more complicated, so I will start this episode. So, first off, big thing: always clean your hands. Just it's a thing, Always clean your hands. Hand sanitizer right here. You want to go like 30 seconds or make sure everything is got, because there's so much grime on our hands sometimes, and when we're injecting, we don't want to risk any type of infection. So that's the first start. Okay, hands are clean. So next step, we're going to take our needles. So this needle, so we have the actual syringe and then the needle that's attached. This is actually going to be the needle that's going to be injecting, that I'm going to inject it into myself. So the sizes can vary for subcutaneous injection needles. So this one is 25 gauge, 1 inch. Now, it doesn't always need to be 1 inch, it could be half an inch. And one thing with the way the gauges work with needles is the higher the gauge, the smaller the needle. So 25 is small, 27 is smaller. So if you have a 27, that could work too, 26. But you always subcutaneously want at least 25, or else it'd be kind of painful going inside, and we don't want that. So yeah, so to start, I'm going to just open everything up. Now, when it comes to this is a like pre-done syringe for subcutaneous. With testosterone is thick. It's a really, really thick substance. And a tiny little needle like that, you can try to draw it up. You're going to spend a lot of time and get really super annoyed. So I would not suggest doing that. So the alternative is we want to get an 18 gauge needle, like a blunt syringe needle, to do the actual injection. So we're going to open up all these guys here. Good. All right. So first thing we're going to do is we're going to change the gauge. So right here we have our subcutaneous needle, and I'm able to take off the needle. So I'm going to place it back in there, and then I'm going to attach the blunt needle, as you see. Okay. So now we're ready to draw up. So another quick thing. These testosterone bottles, you're going to get your testosterone, you're going to use it, you're going to put it in your cupboard. Again, bacteria builds up everywhere. So always remember to clean the top of the vial all the time, even when you first get it. Like you don't know where it's been. So there you go, clean. And so we want to do that for about 15 to 30 seconds. Make sure it's nice. Scrub the hub, make sure it's nice and clean. Okay, so there we go. Now, your physician is going to give you a specific amount of how much you're going to inject. So that will vary from person to person, and that dose will be given to you with the medication. So for the sake of this, I'm going to draw up 0.3. So that each syringe is usually like a 1 milliliter total. So I'm going to draw 0.3. Now, when you draw up, you're going to get a little bit of air. We don't want that. And you always want to try to, like, especially as the testosterone gets, like, you use it more and more, you can see there's not a whole lot left in this bottle. You always want to kind of bring the needle as far down as possible. Yeah, that's so better. You can see it. A little hard to see. So, like, as the fluid is less, you want to move closer to the end of it to kind of grab whatever's there. So you guys see. All right, but you can kind of see the stuff going in there. So all right, so we'll take that out for a sec. We want to get all of that air out. Yeah, and see, and then keep going. There you go, and you can see it come out the end of the needle. And you want to tap it a little bit too, just make sure there's no air in there, because you don't want that. And good. There we are. Okay, good. So we have our thing. So Again, your dose is always going to be different. It can be a little frustrating trying to do it. You're going to get air and stuff like that. It's a feel that you're going to get to it, but just try to be patient with yourself. And again, once the bottle starts to kind of like use up a lot of fluid, you're going to have to kind of bring it to the edge, to the end of the bottle, and kind of draw back and forth. But your first dose will be actually pretty easy to draw. So right here, be very, very careful when you're doing this. I'm going to apply the cap back onto the blunt syringe. You see? Be very, very careful. You can prick yourself, and we don't want that. And then I'm going to screw it off. I'm going to take our sub-Q, screw it on, and now we're ready for the injection. So put that down there for a second. So now next, we are going to actually do the injection. So when we inject, most important thing, so usually people are going to do the tummy. You can go alternate areas for sub-Q, but I would recommend, and what I'm going to show you is the tummy, because usually a lot of us have a little bit of extra pudge there, you know. So, but you want to stay away from the navel. So you kind of want to move around. You want to have like something that you can kind of grab onto. So there's my fat that I'm going to grab onto. Again, clean the skin. We don't want any infections. So I'm going to clean my skin there. Good. Pull off the cap. And I'm going to squeeze the area, right? And in a go. And you want to go about there. You can see almost all the way in. And then we're going to push. Goes a little slow into the subcutaneous. There we are. And pull out. Typically there shouldn't be any bleeding, not for subcutaneous. Can happen. If you do get any bleeding, then just apply pressure for a little bit, and that should take care of things. Now, a couple things to watch out for, like post-injection. If the area where you injected starts to get really red and warm, that could be indication of like an infection. So that I would say immediately contact your physician, just in case. Doesn't happen, but it's just putting it out there that it's a possibility, just to keep an eye out. Now, sometimes it can feel a little bit hard directly after you do it for a day or so. Sometimes there can be a little associated pain, but just watch out for like warm red continuous. All right. So there we go. Now, one thing I would really suggest doing, and I don't have it right here, but to get a sharps container. You can get them on Amazon. They're pretty easy to do. Just to be able to store your sharps, you do not want to throw these in the garbage. That is not a good thing to do. So yeah, so do get that, and then there usually should be. You can look up. A lot of hospitals have drop-off sites for, or pharmacies have drop-off sites for the sharps containers. All right. So there we go. Cool. There we go. One down, and that is probably the most difficult video to show you. So I will see you in the next video where I show you how to inject HCG. See you.